Did you know that your prostate might be silently crying out for help long before you notice any obvious symptoms? Many men assume that prostate problems come with severe pain or dramatic warning signs, but the truth is far more subtle and much more dangerous. These early signals can easily be mistaken for normal aging or minor inconveniences, but ignoring them can lead to serious complications like infections, severe urinary issues, and even cancer. Today, we're going to uncover the most important silent signs that your prostate needs urgent help. You'll learn what these signs mean, why they happen, and what you can do today to protect your health and your future. Don't wait until it's too late. Let's dive in and give your prostate the attention it deserves before those quiet whispers turn into desperate screams.
Weak or interrupted urine stream. One of the earliest and most overlooked signs of prostate trouble is a weak or interrupted urine stream. Many men think that needing to push harder or noticing a slow stream is just a normal part of getting older. But this isn't something you should brush off. The prostate surrounds part of your urethra, the tube that carries urine out of the body. When the prostate enlarges, a condition called benign prostatic hyperplasia, BPH, it squeezes this tube like a garden hose with a kink. This makes it harder to pass urine freely. But the danger doesn't stop there. Over time, your bladder has to work harder and harder to push urine out. This can cause thickening and weakening of the bladder walls. As a result, you may feel like you can't fully empty your bladder, leading to frequent urination, dribbling, and even sudden urges that are difficult to control. Some men start avoiding long car trips or social events because they're constantly looking for a bathroom. Others wake up multiple times at night, leading to poor sleep, fatigue, and even mood swings. In some cases, a weak stream can signal not just BPH, but also a more serious problem like prostate cancer or a urinary tract blockage. One study found that men with severe lower urinary tract symptoms had a higher risk of eventually being diagnosed with prostate cancer. So, it's not just an inconvenience, it's a potential red flag. If you notice changes in your flow, frequency, or urgency, don't wait. Schedule a checkup. A simple prostate-specific antigen, PSA blood test, and a digital rectal exam can provide crucial information. There are also lifestyle changes that can help. Limit evening fluid intake. Reduce caffeine and alcohol, which irritate the bladder. Practice double voiding. Try to urinate, wait a few minutes, and try again. Remember, your stream is like your body's report card. Don't ignore what it's trying to tell you. Pain or burning. During urination, pain or burning when you urinate is another silent sign your prostate needs immediate attention. Most men assume this means a urinary tract infection. But in men, true UTIs are relatively rare compared to women. Instead, this can often be a sign of prostatitis, inflammation of the prostate gland. Prostatitis can develop from a bacterial infection, but it can also occur without any infection at all. Inflammation might come from stress, immune reactions, or even sitting too long, which restricts blood flow to the pelvic region. Many men experience a mild burning sensation at first and choose to ignore it. Unfortunately, if left untreated, prostatitis can become chronic, leading to a cycle of recurring discomfort and pelvic pain. Painful urination might also accompany other symptoms like difficulty starting or stopping urination, a feeling of incomplete emptying, or even pelvic heaviness. In some cases, this burning can be a signal of more serious conditions, such as prostate cancer or bladder stones. The emotional impact is also significant. Men often report anxiety and embarrassment, fearing that something might be seriously wrong. This stress can further worsen symptoms by tightening pelvic floor muscles and increasing nerve sensitivity. If you're experiencing burning, don't self-medicate with cranberry juice or assume it will go away. Instead, get evaluated. Your doctor might perform a urine test, PSA test, or even an ultrasound to check for hidden issues. Besides medical treatments, lifestyle habits play a major role. Drink enough water to flush the system, but avoid excessive caffeine and alcohol. Avoid prolonged sitting. take breaks, and walk around. Manage stress with relaxation exercises like deep breathing or yoga. Remember, pain is your body's alarm system. Ignoring it might silence the alarm, but it won't solve the problem underneath. Blood in urine or semen. Blood in your urine or semen, even if it's just a faint pinkish tint, is always a serious sign. Many men dismiss it if it only happens once, thinking it might be from straining too much or temporary irritation. However, this can be your body's desperate plea for attention. Blood in urine, hematuria, or semen, hematospermia, can be caused by infections, prostate enlargement, or trauma, but it can also indicate prostate or bladder cancer. While some benign causes exist, it's crucial not to take chances. Cancer often starts quietly, and microscopic bleeding might be the only early clue. In some cases, bleeding is painless, which makes it even easier to ignore. But if you notice it, you should seek evaluation immediately. Your doctor might perform a cystoscopy, a scope inside the bladder, imaging studies, or PSA blood tests to determine the cause. Beyond the physical danger, there's a psychological burden. Men often feel anxiety and fear, but are too embarrassed to seek help. Unfortunately, delaying care can reduce survival rates and complicate treatment options. If you see any unusual color changes, don't wait. Document it, take a photo if needed, and bring it to your doctor. Some preventive tips include staying hydrated to maintain urinary health, avoiding excessive straining during heavy lifting or intense exercise, eating anti-inflammatory foods such as tomatoes, green leafy vegetables, and berries. Remember, your body rarely lies. Listen carefully when it shows visible clues like blood. Painful ejaculation or sexual dysfunction. Painful ejaculation or changes in sexual function can be shocking and deeply frustrating for men. Many brush it off as just aging or stress, but it can actually be one of the first signs of prostate problems. Your prostate contributes fluid that nourishes and protects sperm. When it's inflamed, prostatitis, or enlarged, BPH, it can interfere with the normal flow and cause pain during or after ejaculation. This pain can range from a mild burning to a sharp ache that lingers for hours. Some men might also notice a decline in sexual desire or difficulties maintaining an erection. There's a major psychological burden too. Men may start avoiding intimacy, fearing embarrassment or discomfort. Over time, this affects relationships and self-esteem. One important thing to remember: these changes are not just about aging. Hormonal changes, nerve dysfunction, and blood flow issues tied to prostate health all play a role. If you notice sudden or gradual changes, it's essential to speak up. Solutions exist, from medications that reduce inflammation to therapies that improve pelvic blood flow. At home, you can support sexual health by practicing pelvic floor exercises, Kegels, to improve control and circulation, maintaining a healthy weight, and reducing sugar intake to support blood vessels, managing stress through mindfulness or counseling. Above all, don't let shame keep you silent. Early intervention can restore your confidence and intimate life. Lower back, pelvic, or hip pain. Persistent lower back, pelvic, or hip pain might not just be bad posture or old age. It can be a sign of advanced prostate issues, including cancer that has spread beyond the gland. Prostate cancer can silently spread to bones, particularly in the lower spine and hips. By the time pain shows up, cancer may have already advanced, which is why early signs are so critical. Unlike normal muscle pain that improves with rest, prostate-related pain is deep, constant, and unrelenting. It can interfere with daily activities, sleep, and even your ability to walk comfortably. Men often ignore this pain, thinking it's arthritis or sciatica. But if your pain is persistent and paired with urinary or sexual symptoms, consider it a big red flag. Diagnostic tests include bone scans, MRI, or CT scans to assess potential metastasis. Taking action early can dramatically improve treatment outcomes and quality of life. To support your musculoskeletal health and reduce inflammation, incorporate anti-inflammatory foods like turmeric, berries, fatty fish. Stay active with low-impact exercises like swimming or walking. Avoid prolonged sitting. Change positions often. Pain is a signal, not a nuisance. Listen to it carefully and take steps before it takes control.
Your prostate health is too important to ignore, and by paying attention to these silent signs, you're already one step ahead in protecting your future. Remember, small actions today can prevent big problems tomorrow. Eat right, stay active, get regular checkups, and always listen to your body's quiet warnings. If you found this video helpful, please give it a thumbs up, leave a comment below to let us know your thoughts or share your experience. And don't forget to subscribe so you never miss our science-backed health tips for men over 50. Thanks for watching. Take care of yourself. And remember, your future self will thank you.